Turmeric, known for its anti-inflammatory properties, can complement non-steroidal anti-inflammatory drugs (NSAID), the likes of diclofenac, ibuprofen, piroxicam, meloxicam, aspirin, and so on, in managing conditions such as arthritis. Studies have shown that curcumin, the active ingredient in turmeric, can enhance the effect of NSAID, reducing inflammation and pain more effectively when used together. Here are more things to know about the use of turmeric. Turmeric is used for arthritis, heartburn, that is dyspepsia, joint pain, stomach bloating, loss of appetite, stomach ulcer, and irritable bowel syndrome. We also make use of it in cases like jaundice, high cholesterol, and for various skin conditions. Turmeric contains the chemical curcumin. Curcumin and other chemical principles present in turmeric might decrease swelling, that is inflammation. Because of this, turmeric might be beneficial in conditions that involve inflammation. Turmeric is likely safe when taken by mouth or applied to the skin appropriately for up to 8 months. Turmeric usually does not cause significant side effects. However, some people may experience stomach upsets, dizziness, nausea, or diarrhea. Pregnancy and breastfeeding. During pregnancy and while breastfeeding, turmeric is likely safe when taken in amounts commonly found in food. However, turmeric is likely unsafe when taken by mouth in medicinal amounts. It may promote menstrual period or stimulate the uterus, thereby putting the pregnancy at risk. One of my patients had such experience. When asked, she said it was a friend that told her to soak turmeric and clove and drink daily. If not for adequate medical intervention, it would have been otherwise. So, do not take medicinal amount of turmeric if you are pregnant. Also, there is not enough information to rate the safety of turmeric while breastfeeding, so it's best not to use it. Gallbladder problems. Few days ago, I came across a video by one of those online herbal vendors telling people about a concoction to eradicate gallstone, in which one of its main ingredients is turmeric. Well, sorry to burst your bubble. Turmeric can make gall problem worse. So do not use turmeric if you have gallstone or bile duct obstruction. Bleeding problems. Taking turmeric might slow blood clotting. This might increase the risk of bruising and bleeding in people with bleeding disorders. Diabetes. Curcumin, a chemical principle in turmeric, might decrease blood sugar in people with diabetes. So, use with caution and ensure to monitor your blood sugar. Infertility. Turmeric might lower testosterone level and decrease sperm movement when taken by mouth in large amounts in men. This might reduce fertility. So, turmeric should be taken cautiously in people trying to have a baby. Iron deficiency. Taking high amount of turmeric might reduce the absorption of iron. Turmeric should be taken cautiously in people with iron deficiency. If you are awaiting surgery, turmeric might decrease blood clotting, which might cause extra bleeding during and after surgery. So stop using turmeric at least 2 weeks before a scheduled surgery. Some medications are changed and broken down by the liver. Turmeric might decrease how quickly the liver breaks down such medication. Taking turmeric alongside those medications might increase the effect and side effect of those medications. Some medications that are broken down and changed by the liver include antihypertensives like losartan, some calcium channel blocker like verapamil, diltiazem, nicardipine, also antifungals like ketoconazole, itraconazole, glucocorticoids, lidocaine, and so on. So, talk to your healthcare provider if you are taking turmeric and such medications. Your herbal pharmacist is here to help. Medication for diabetes, that is anti-diabetic drugs. Turmeric might lower blood sugar in people with type 2 diabetes. Anti-diabetic also are used to lower blood sugar. So So using high dose of turmeric with anti-diabetic medications might make the blood sugar to go too low. Some medications that are used for diabetes include glimepiride, popularly known as Amaril, glibenclamide, known as Daonil or Clamid. You have insulin, glycoside, popularly known as Diamicron or Remicron, and so on. So, using high dose of turmeric alongside such anti-diabetic medications might make the blood sugar to go too low. So there is a need to review and change the dose of the anti-diabetic medications. Medications that slow down blood clotting, that is anticoagulant or antiplatelet. Turmeric might slow blood clotting. Taking high dose of turmeric alongside medications that slow blood clotting might increase the chances of bruising or bleeding. Some medications that slow blood clotting include aspirin, clopidogrel, warfarin, heparin, enoxaparin, and so on. So, care should be taken when taking medications that slow down blood clotting alongside with a high dose of turmeric. It's need for professional counseling. Estrogen. Large amounts of turmeric might have some of the same effect as estrogen. However, large amounts of turmeric are not as strong as estrogen pills. So taking a high dose of turmeric along with estrogen pills might reduce the effect of estrogen pills. This is an important consideration in elderly women who are on estrogen to manage symptoms of menopause, such as hot flash, bone loss, and vaginal changes. Quite a number of these elderly women are also on a high dose of turmeric, either in food form or in combination as supplement to manage symptoms of arthritis and so on. So there is a need for close monitoring and professional counseling to ensure the efficacy of the estrogen pills. Norfloxacin. Norfloxacin is an antibiotic. Turmeric might increase how much norfloxacin the body absorbs. So taking high dose of turmeric alongside norfloxacin might increase the effect and the side effects of norfloxacin.